A facelift is a facelift is a facelift. The difference is in how people name things, try to brand things so that make themselves unique. With a typical facelift, and pardon my back, what you're doing, you're going to undermine the skin, and it depends on how much you undermine the skin in order to, so just like making a bed, lifting the tissue up, redraping it, getting rid of the extra tissue. You know, a mini facelift, you're doing pretty much a little bit of undermining of the skin. Okay, with a regular facelift, you're coming out over the cheekbone, close to where the crease is here, the nasolabial crease, and then down onto the neck. Pretty much all the neck skin gets lifted up, and you can go down to the collarbone depending on how much, you know, focus. What if somebody has a lot of loose skin down here, you dissect down lower. That's part of what you do. And in order to do that, you want to hide the scars so nobody sees the cuts and the scars. So typically there's a cut that goes right in front of the ear, and it's a curved zigzag cut. Straight cuts tend to be more visible, and depending on what you're trying to fix, you either make a tiny little cut in the sideburn area, or you can continue that up into the side of the head, the temple. So if somebody has a lot of crow's feet, a little bit of a loose brow, I take my cuts up higher, and you can lift that lateral brow doing it that way. The difference is in facelifts, and where people alter that as you go behind the ear, and then where the ear meets the hairline, that's where you're curving your incision back into the hairline. That's the scar behind the ear that can have problems healing sometimes. A couple reasons for that is where that cut is back there from all the undermining on the neck, that skin, that scar is farthest from its blood supply, so that can affect the way the scars heal. The other thing is you do close and pull the skin on the neck with a little bit of tension. So there's tension on that scar can thicken up, get lumpy. If you don't plan your scar correctly in the hairline, you can have a visible scar or a step off in the hairline. So surgeons have been trying to limit that scar in the hairline as much as possible. I still like it. Because when somebody's got loose skin on their neck or muscle, you'll want to pull that sort of straight back going this way, almost horizontally, to get rid of it. If you shorten this scar, the pull is going to be vertical, going up the neck. And everybody's probably seen them where somebody, when they tilt their head down, they look like they're getting hung. And that's what they're doing. They pull straight up this way, and as soon as they position, it's a telltale sign they got this, like, you know, internal rope around the neck. So the more junk you have going on in your neck, I like a longer cut in the hairline back here. So if you have to, you know, you got to watch the way that your hair is, that it's long enough to hide that scar while it's healing. It probably takes a good 6 months for that scar to really be acceptable enough that you can pull the hair back and not have to worry about people looking at it. But the skin's the only one part of it. This is the gross part. See if I can get this to turn. There we go. And again, too, I mean, it's like the analogy of making a bed. You've lifted the comforter up with the skin. When you redrape the skin, you don't want to close anything under any tension, because if you do, that's when you're going to start to see some abnormalities of the scars. What I usually see with people with lifestyle lifts, they'll have the pixie ear deformity, because you pulled the skin tight, and as gravity starts to take effect, it pulls the earlobe down, and they got the little pointy Spock earlobes. The most important part, what you're trying to do, is after you get that skin up, is the covering on these muscles. These are the muscles of facial expression that make you smile and frown at all. So, zygomaticus major, minor, I won't test you on these. The muscles here, the covering over your parotid gland, all of them are in the same plane as the platysmal muscle on your neck here. So what you're doing, what I do, is to take the covering on those muscles, and on the cheek, you're pulling it up more at a 45-degree angle and anchoring that muscle layer down to something that's stiff, like the cheekbone here. So you're pulling and sewing and tightening that muscle layer up this way, and then when I get below your jawline, I'm pulling straight back and hooking to the muscles back by the ear here. So when you're pulling the muscles, you're also pulling the skin with it. The face of the neck is the only part of your body where muscles will insert directly or indirectly on the skin so you can smile and frown. So when you grab that muscle and pull, the skin's going to follow. You get even a better redrape of the skin when you're getting rid of the extra skin. And that's where the differences in facelifts will lie, as to how people sew and tighten those muscles up. Some people just do it with 1 or 2 stitches. I like doing my facelifts with the little barb sutures, because you can distribute the tension more evenly over that muscle pull. Some people physically cut and go underneath the muscles and lift and pull them up. That gets a little bit more tricky and dangerous, because the nerves that make those muscles work all innervate on the underside. And when you're cutting and going underneath those muscles, that's when you run the risk of injuring some of the nerves.
So what's the difference between that and the lifestyle lift?
Lifestyle lifts are pretty much a mini facelift. You're undermining the skin a little bit. I would assume they're trying to put 1 or 2 little hit stitches in the muscles, and that's it. So you want to know, it's not necessarily, well, you know, it's a lifestyle lift, is it a mini lift, is it an awake lift, or how people name it, is how aggressive, how far you're going to undermine my skin, what are you doing to tighten the muscle layer underneath.
Can you be awake during a facelift?
I do a lot of my facelifts totally awake under local anesthesia here. You know, yeah. Oh yeah. A martini or two and a cigarette, you're fine.
Up there, sign me up.
When you do a facelift, before you even start making a cut, you're putting in a whole bunch of dilute local anesthesia solution, like liposuction. So it acts like a wetting solution. It helps to separate the tissue planes so it's easier to lift up the skin, tighten the muscle up. The wetting solution you put in has dilute local anesthesia in it, so it helps with pain control. So there's really no pain once you put it in. There's epinephrine, the drug that helps the blood vessels to constrict so you don't bleed. So I put a whole bunch of local anesthesia in no matter what, whether I'm doing them in awake here in the office, whether I'm doing it at the surgical center under sedation, under general anesthesia. You know, the difference is you don't have the effect of all the chemicals of the general anesthesia, the intravenous fluids that they're giving you. Most of my patients, there's a lot less bruising and swelling that they have doing them on straight local in the office. They tend to recover quicker. You know, if somebody has obviously medical issues or problems, we go to the surgical center.
What do you expect when you leave? If you had it done in the office and you were awake and you go home, what could a patient expect?
Because of the local anesthesia that I put in, you're pretty much numb for a good 4 to 6 hours. From sewing and tightening the muscle layers up, it hurts. You will need pain medicine for a couple days. I mean, people walk out of here thinking, oh, this was great. This was really, really easy. And then later that night when I call them, they're like, I am in a lot of pain. I mean, it is uncomfortable. You do feel it. So like the eyelids, 2 days you're doing nothing but icing yourself up, making sure that you're not bending over doing anything. The less muscle pull and tightening that you do, sort of like a tummy tuck also, if you don't tighten any muscles up when you do a tummy tuck, recovery's simple. It's just a skin operation. But again, you know, if you could see this in the operating room, or there is a video that I got on YouTube of this, you can see how loose the muscles are once the skin is up. And then it makes perfect sense. Like, why wouldn't you do something to tighten and, you know, reposition those muscles when you're doing a facelift? But recovery-wise, you know, pain for a couple days. You can. Usually see you back within a day. Take the light dressing off that I put on. If everything looks okay, you go home. You can shower, wash your hair. You should be back driving a car functional within a week. Between week 1 and week 2, that's a transitional week. You should feel like you can do everything. You'll still be self-conscious with the way that you look. There'll still be a little bit of bruising there. Proportion-wise, things are not quite back to normal, so they don't look quite right. You'll know it. Nobody else will know it. You'd be shocked, you know, that people that have facelifts done, that even just walk in this office that are a week or 2 out, people don't know. They won't be able to pick anything up, even though the patients are very self-conscious.
And how long does the facelift last?
Facelifts last about 5 to 7 years, no matter who does them, how they do them. And there have been some decent studies that we published in the literature out there doing skin-only facelifts, skin and just excising some of that, covering fascia and sewing it, undermining it, stitching it, deep plane where people are going over top of the bone. They all last about the same, because it all depends on the quality of the tissues. The flaw of the facelifts, you know, the couple of flaws is, one, you're working against gravity, so gravity's still going to continue to work to pull things down. Number 2 is, you know, you're pulling back here, incision-wise, trying to make changes in this area. So when facelifts start to fail, the central part of the face and neck is where you're going to start to see the rebound, where things are starting to get loose again. And the other thing is, with doing all this, you've done nothing to repair the elasticity in the tissues at all. So we've tightened tissues, but they're not quite normal tissues anymore. They don't have the strength to snap in them. They're going to rebound quicker. That's why you see things when people are doing facelifts now, where they're talking about like the smart lipo, slim lipo, where they're like putting lasers underneath, trying to tighten the collagen in tissues. If they're working on that, that's dangerous because you're burning the tissue underneath. You could have some healing problems. But they're trying to figure out how to improve the elasticity, quality, snap of the tissues they're working with.